I think golden rule is that if you trust and respect your nurses, then they will help you out the same. And like, that's such a huge part of surviving and thriving in residency. Same thing goes for any allied health. And so like physiotherapy, like asking them like, hey, I don't really know, like, what is this patient's mobility status and like, how does it matter? Like, for example, if they're not climbing stairs, and like, what does that mean for discharge? They will know.
Hi, welcome to Specialty Cafe, a podcast by the Royal College of Physicians and Surgeons of Canada. My name's Mark, and I'm a fourth-year medical student at McGill University. I'm your host today. I'm glad to be joined by PGY1 at the University of Alberta in internal medicine, Cameron Wong.
Hi, everyone.
Thanks for joining, Cameron. As most of you know, Cameron used to be a host on this podcast, and or still is a host, and is kind of transitioning into a residency role now. So really happy to be here to kick off our day one of residency campaign with him and learn a little bit about what day one of residency looked like for him. So thanks for joining us, Cameron.
Of course, a pleasure to chat with you, Mark.
Yeah, so maybe you can walk us through post-match. What did that look like for you?
Post-match, I think for most people, it is a combination of wrapping up medical school. Some people have rotations, especially if they're in a 3-year program. I think you are wrapping up your core rotations versus in 4th year, maybe some electives. You must go on vacation. It is one of the last times that you will have such an extended break and no responsibilities. And I think me and most of my classmates went on very refreshing vacations. I went to Southeast Asia. Many other people went there. Many people went to Europe. Many people spent time with their families as well, especially if you are making a big move for residency. Very important. And no studying. I didn't do any studying. I don't think any of my co-resident friends did any studying. And I think that was a big part of it. There can be a lot of pressure, especially with, excitement with matching to residency, but then thinking, oh, like, what are the expectations? Like, should I be opening a book? And no, I don't think so. And then, just getting oriented to things. Things will naturally flow. You'll go through hospital orientations. You'll meet your co-residents. It's all a very exciting time.
And you moved from Kingston, Ontario to Edmonton. How was that transition going from, one province to another, across the country?
It was a big transition. I thankfully had a lot of help, especially from my family. I am originally from Alberta, so it was easier for me to come back home to like a familiar province, and most of my extended family is from Edmonton.
Right.
And I had the help of my mom and dad who came to Kingston, and we figured out that instead of having multiple family members take multiple check-in baggages on like a WestJet flight, we found that usually you can get like a similar price if you just ship it through Purolator. So we did that, and we shipped my entire house, all 7 big Canadian Tire cardboard boxes of things, and we shipped it to Edmonton.
That's awesome. It's good to know. Great advice. Something that's stressing me out is the day before residency. So I don't know if I mentioned this before, but I matched to Toronto. I'm looking forward to it, but I can't get over the day before residency starts. What am I going to do? What's going to be my routine? What's going to be my plan? What did that look like for you?
So you're starting orthopedic surgery. Yeah. I guess it doesn't really matter. Like, I'm an internal medicine, as you mentioned, but the first day of residency is going to be chaotic. It's like any big transition in your life, something that you will overcome, and but you'll figure out a lot along the way. Day before residency, I would say something like similar to like when the day before you started clerkship. That was a big transition for you as well, I imagine. Like you were going from the classroom in McGill and you're going into the hospitals having some level of responsibility. And this is very similar to residency. The difference is that you have an MD behind your name, MDCM for you, and you will be able to sign medications. And so it's a big step, and it feels like a lot of responsibility, but I think just know that you have a lot of people behind your back and you're always well supported. That being said, I guess specific logistics before the day of residency, I guess like I would recommend similar things. So again, make sure that like you are cooking for yourself again, that you have like a nice lunch prepared. Maybe if it might help you feel more oriented, like reach out to an upper year buddy, especially in your program, and find your way around the hospital, find where the scrubs are, find where the good hospital food is. Maybe find the call room, find your pager, your hospital badge, all of the logistics that's you kind of maybe have figured out, especially if you've done traveling electives, then you know the challenge of trying to orient to a new hospital. So similar things. I think you got it all.
Yeah, awesome. And kind of going into residency, I feel like, we all stumble along the road. Is there anything that you kind of found difficult transitioning into? What was your first order, for example?
My first order was adult diet regular.
Okay.
But I did have some challenges on the first day.
Yeah.
So, I started my first day on CTU at the University of Alberta Hospital. So it was a familiar environment, but not so familiar role, because I'm clicking orders and I'm thinking like, well, is anyone going to co-sign these? Like, who's looking over these? And be assured, someone is looking over your orders. Maybe not like the minor ones, like you're changing the frequency of like a Tylenol PRN order, but the major orders, someone is always looking over you. A senior resident is, the attending is as well. So you're being closely watched and helped out there. I remember having difficulties like around insulin ordering, which is a big part of internal medicine, hospital medicine, and I think someone went hypoglycemic, and I ordered a really, really expensive intranasal glucagon spray by accident and wasted a lot of money. It didn't even work, but that's all a part of the job.
Yeah. Did you get ripped on by staff, seniors, anything?
They were very, very kind, and they didn't think anything of it. I was super hard on myself. I was saying like, wow, what a waste of money, and I didn't even help the patient. They were saying like, you didn't hurt anyone, and this is all part of the process.
Fair enough. Fair enough. Now you're, good chunk into your first year. What do you think of the transition into, being a junior resident to being more, accustomed in the hospital? How do you feel now? Are you comfortable? Is it true that the learning curve kind of plateaus eventually?
Yeah, I think the learning curve will plateau when you become more comfortable in your current role, and then always the floor drops. And so like I will become a PGY2, and then the floor will drop, and I'll be expected to senior and manage a ward like in a more supervisory capability. And so I think at any points of transition, it's going to be harder. That being said, like I would say most people through like halfway to 75% of PGY1 find that things just get a lot easier when you're more accustomed to putting in orders yourself and like finding your own hospital workflow in whatever EMR you're using. I think in Toronto you'll use Epic.
Yeah.
But I mean, similar to clerkship, you spend maybe 50 to 60% of your day in the EMR. When you get comfortable with it, when you've learned your smart phrases, your order sets, and find out like all there is to it about it, then things just get easier. You kind of start to realize, oh, that's it. Like I can do this.
Yeah.
And so, but it does take some time, obviously. And I think I do find that at this point, I'm like a lot more comfortable. I go into like my work day and there's much less surprises as opposed to day one where like almost everything is a surprise. Like, ordering a diet was a surprise to me. I could do that without any cosign. So yeah, those are my thoughts.
Yeah, that's awesome. That gives me someone like me who's kind of worried and still in the beginning of these phases, a lot of confidence that, things will get easier, things will get better.
It will get easier. And I think maybe you'll get the sense that in a similar way, it's like when you started clerkship and when you went into different rotations, you start to realize like, even though these are different environments that you're going to, you'll rotate through different 4-week rotations through everything and do a lot of off service as well. You'll find that even though you're like being forced to adjust to all these different environments, you can adjust with pretty good comfort.
Right.
Yeah. Even though it's like there will be like minor surprises, you'll get in the hang of it.
Yeah, it's very reassuring. I think a huge chunk of the people listening are interested in internal medicine, makes up a big part of the residents that are in Canada. Do you have any advice for like stream selection? I know that's a big thing with internal medicine because you guys have so many different rotations.
Stream selection, like rotations in clerkship, right?
Yeah, like stream selection in terms of like, do you start with an internal medicine elective when you start residency versus a CTU versus a different mandatory service?
I think, yeah, for internal medicine, honestly, I don't think it matters too much. Some people started out with internal medicine and like in my class at Queen's and matched internal. I put internal maybe towards like the middle of clerkship. Clerkship, I think not so different from residency, is a bit of a grind. And so if you put it in the middle where like you're more experienced but not entirely I guess taxed with going through all those different rotations, it's good. And so I think I would recommend that.
Okay.
Probably similar for most specialties. I think most people put their rotations in the middle of clerkship.
Fair enough. Okay. So how would you recommend going about prescribing something? You know, you're on call the middle of the night, you don't want to wake up your senior resident. What do you do?
This is such a different, I guess, approach than in clerkship, because you have to have everything co-signed as a medical student. It doesn't even matter if it's a diet order or if it's a Tylenol or if it's like a large fluid bolus or like an important antibiotic. You had to get everything co-signed. But of course, it's different when you're a resident and you can sign things independently. I would say like on your first day of residency, like maybe don't be ordering like pressers like independently. Like that's probably like at the point where you should be discussing things with like a senior resident. So it's really about like clinical gestalts. You probably have enough like common sense and honestly like clinical judgment from being a medical student to like say, well, I can order this fluid bolus, like a small fluid bolus, just to make sure someone's blood pressure is like holding steady, as long as they're not actively crashing. I think I can order this diet, or I think I can discontinue this like pain medication if they don't want it anymore. Some things, and it just does take some getting used to. Honestly, like first day, everyone knows that you're in a new role and you're probably feeling very nervous about everything. So you could run almost everything by a senior resident. I would be very happy to review everything like for my junior, honestly, even if it is something as simple as a diet, because it feels like a huge burden, but I don't think that anyone will fault you. Even the attendings know that like first day is like a really big thing, and they're watching out and making sure that everything is as it should be.
Right. Okay. I think something else that's maybe a little bit intimidating for me is calling other services and saying, hi, I'm X, because as a med student, you can always just drop it's the med student on internal medicine card and they're nice to you. But then as soon as you transition to residency, it gets a little bit more, now you're part of their team. You're supposed to know what you're talking about. You're supposed to, have all the information in front of you. And it's a little bit intimidating to, ask a staff a question or, stick up for a patient in front with a different service that, might not take it so well.
No, I mean, oh my gosh, this is it's such a big thing in the hospital to consult other services. It feels like such a stressful event, and I think it will feel stressful maybe for the rest of my life, especially if I'm asking like a very subspecialized person and like, or do I remember enough from med school urology in order to like ask someone for CBI basically. But I would even say like when you're consulting in the first few days of residency, even just prefacing like, I'm sorry, this is like my first day of residency, my first week of residency, my second week of residency. I hope this is okay what I give you. Let me know if there's anything more. Even if you want to rehearse it with like your senior residents, I'm sure they would be like more than gracious to help you out. And again, I think everyone in the hospital knows that it's first week or first month, second month. Everyone is feeling a bit new, and things just take time to get into place. So it's like, I guess I talk a lot about transitions from clerkship to like a residency, but also everyone to this point has gone through transitions from like, let's say grade 3 to grade 4 or like grade 6 to grade 7, elementary to junior high, at least in Alberta. And I mean, you learn things like you learn long division. I mean, it's tough, but like you get the hang of it and then it gets easy and then you move on. But people know and people are there to support you for it.
Okay. Awesome. Something I really want to take away from this conversation is the 24-hour call. In Quebec, we're fortunate enough to not have that as med students or residents. But now I'm transitioning into Ontario, and something that's on my mind, something that's, really it's not worrying, but, it's something that I know I'm going to have to get used to. Do you have any tips for, those long calls? How do you manage it? What's your go-to, meal? What does that look like for you?
24-hour call is really tough. I will usually have to mentally prepare for it. Like at least like a few days before. So like I put everything in my calendar. Like I know exactly when my call is, so I can kind of structure my like days around it, make sure to like get a good sleep as much as possible. Not always possible in residency. I think I always come back to like Maslow's hierarchy of basic needs. And so it's really hard to clinically reason around like an undifferentiated medical case when you're not well fed, well hydrated, well slept. So I make sure to like meal prep if possible. And if not possible, then like I will usually like do an Uber Eats or like takeout right before my call. Just make sure I have a meal for every time of the day. Breakfast, lunch, dinner number 2 at 3 a.m. if like you have to stay up, because it's very important. I was given a tip from a senior IM resident that if you really do have to stay up all night, then chugging an iced coffee or a coffee at 4 a.m. seems to do the trick, because caffeine, I think, generally has a half-life of 6 hours. So it will last you until maybe 10 a.m. when you have to hand over, and then you can go to sleep. So 4 a.m., 3 a.m. sounds to be like the right time if you need to drink a coffee.
Okay.
Yeah, otherwise, really, food, water, and sleep are the most important. I know they're like the hardest to achieve, but even if it means Uber eating something in the middle of the night, it's worth it.
So I think something that's been a huge resource for me as a med student, and I imagine is for you as a resident and med student, is nurses. What do you learn from them? How do you manage that relationship? What does it look like? I know it looks different at every institution, but what does it look like for you?
Oh, I was so lucky to have amazing nurses on my CTU. They helped me out so much. Even though you have a new MD behind your name, you are a junior doctor. So you just don't have as much experience, especially like in ordering things. And you are working with nurses of 20 years, nurses of 30 years who like are so good at their job and honestly have seen like algorithmic like what happens in like scenarios. If someone goes hypoglycemic, like what do you do? Sometimes they're already doing it and they just message you like, hey, I've already given them dextrose. Can I have a cosign for this? Or if someone is crashing, like they're becoming hemodynamically unstable, they might say, hey, I've already called like the ICU team or like the rapid response team, just letting you know. And so I think that really speaks to like how much expertise they have. Action item though, that I think I would recommend is just like being humble and saying maybe to nurses, if you're unsure, hey, I am on my second day of residency. I don't really know what's going on here. In your experience, what have you seen? Like, what have you? And like, they're so nice to help you out. I think golden rule is that if you trust and respect your nurses, then they will help you out the same. And like, that's such a huge part of surviving and thriving in residency. Same thing goes for any allied health. And so like physiotherapy, like asking them like, hey, I don't really know, like, what is this patient's mobility status and like how does it matter? Like, for example, if they're not climbing stairs, and like what does that mean for discharge? They will know. They've been doing this for like maybe a decade or more, and they'll be really happy to help you out. Occupational therapy, social work, RT, they're all like wealths of knowledge, and they'll continue to be maybe for the rest of your career. I will definitely like rely and learn from like my nurses and other allied healthcare workers for the rest of my life.
Yeah, fair enough. It's really good to know. It's a really good resource to have. I'm not sure if you've thought about this yet, but IM is kind of unique in that you have a second match to go through. When do you start planning for that? How do you start planning for that? Now it's kind of a smaller community that you're within. So what does that look like for you?
Yeah, it is very niche. IM as an entry specialty out of Carnes feels, I guess, a little bit less personal. It actually doesn't really matter that you become like buddy with program directors across the country. Like, they'd be happy to know you, I imagine, but it's not as like who knows who, especially in the IM world, especially when there's like hundreds of applicants to each program. That's not the same as like for subspecialty. I think that is very much the case. And like, yeah, any of them, cardiology, gastroenterology, ICU, it's more so it matters like who you know and like the connections you make. And so I think that's a bit of a different feel for me, getting to know like some of the fellows who I think will maybe be my colleagues one day, like in a subspecialty. Yeah, it's a different feel for sure. And it's obviously stressful going through a second CARMS. I can definitely empathize with everyone who had just gone through the recent CARM cycle. But it's just something that you go through again. It's exciting. It's like another path to like specializing more.
Fair enough. Awesome. Nice. Well, Cameron, I think that's everything I've got for you. Thank you so much for joining us. Really appreciate your insight and, definitely helped me get ready and prepped for the first day of residency.
Of course. A pleasure to chat with you, Mark, as always. And you and every incoming resident across the country will do fantastic. It might not feel like it in the first few days, but you have earned that MD and you will do amazing things. And everyone who is in a higher stage, be it like a senior resident or an attending, they have all gone through what you have gone through. They have all been uncertain about ordering Tylenol. They have all been uncertain about someone's clinical status. If like they're truly, truly, really sick, that's a whole part of like going through so much medicine. And they will be happy to help you out.
Awesome. It's really appreciated. Thanks, Cameron. And thanks to everyone for listening. Once again, my name is Mark. I'm with the Specialty Cafe podcast. As part of the Royal College, don't forget that as a resident, you can sign up as a resident affiliate. It's free to join and there are tons of benefits. Until next time.